do believe that there are emerging trends that can affect upstream factors related to drug utilization and medication management that can have downstream effects, downstream benefits on drug plan costs. I had mentioned last year that the consumer appetite for health self-management is growing. I talked about pharmacies last year pivoting to become health and wellness destinations for patients, both for their own commercial reasons and also for a patient care perspective. And also about large technology companies and venture capital really putting a lot of money and attention into healthcare. They all want to disrupt healthcare. Okay? Now, since last year's conference, I've noticed a trend that all three of these stakeholders have really started to converge on, and that is behaviors. It's all about changing behaviors. But sustained behavior changes are really hard, really, really hard to do. And I believe that the way that you get them is when you have people who are engaged, and to borrow a phrase from B.J. Fogg, who's a prominent researcher at Stanford, is that people need to be engaged, but they need to have the sufficient motivation, ability, and triggers to make these habit changes and make these sustainable, permanent changes to their lifestyles. And one of the things that I think that the technology companies in this trend has really noticed is that better data capture and sharing is necessary, but insufficient. A lot of these quote-unquote 1.0 generation technologies really focus on giving you lots of data, right? But I believe that it's necessary but insufficient to drive these sustained behavior changes. Okay? So what's required? How do you get engaged people with motivation, ability, and triggers to make these changes? I believe that there are 4 key drivers. Number 1, we need to enhance, not replace, the interactions that patients have with their healthcare providers. Okay? It needs to make it easier to do the more desirable behaviors and more difficult to do the less desirable behaviors. Technologies and innovations need to help people do hard things that match their current levels of motivation. And from a pure technology perspective, we need frictionless, ubiquitous, continuous data capture and sharing. I'm going to show you 3 examples of companies and innovations that I think are sort of on the right path in combining some of these drivers. First one is Ginger.io. Ginger.io is a program that is specific for the mental health population, so patients who suffer from depression or anxiety. And what happens is a patient who enrolls in this program, are assigned a coach, okay, and they have a smartphone app. Similarly, a product called Propeller is a program for patients with chronic respiratory disease. And what Propeller does is it gives all the participants a little sensor that they attach to the end of their inhaler. And then patients use the inhaler as directed. The studies that they've done have shown a 2 times higher adherence rate to inhalers than non-users and better asthma control, resulting in lower acute exacerbations of asthma. Proteus, they make sensor-enabled pills that enable monitoring of when you've taken a specific drug, what some of your biometric data are, what was your blood pressure, your heart rate, etc. All 3 of these examples, I believe, enhance collaborative care. They combine the 4 drivers that I talked about of sustainable behavior change. And what's interesting is that they target very specific patient populations that require more intensive monitoring. Right? So we're starting to see a little bit of a segmentation, the wellness sort of population and use case, and then the more medical, so to speak, use cases for these products. For some of these populations, that's what they require. They require a more intensive monitoring that has not been really possible up until some of these new innovations. All 3 of these companies are focused on a more B2B versus B2C strategy, so they partner with large employers, health systems, hospitals to enroll patients in these programs, and they give them these tools to help the care teams better monitor these populations. And adoption of these products has really been spurred by a trend in the US of moving away from fee-for-service payment models to more of a fee-for-value payment model, where care providers are looking for more cost-effective ways to manage large populations of patients with asthma, for example, or depression and anxiety. And these technologies seem to offer a way for them to do so. Final words, and I believe that the trend in medication management right now is increasingly focused on how do you spark and sustain behavior changes that are required to make enduring health outcomes possible.